Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, nasal insulin. Nasal insulins are two preparations. We have Exubera, which is a nasal insulin. Similarly, we have Alfreza, which is also a nasal insulin. First, Exubera. This Exubera is the first nasal insulin which is developed. But this Exubera is actually banned. Why? Because it has no added efficacy. It is almost similar to the subcutaneous insulin without any added efficacy. But why is it banned? Because of the pulmonary complication, which is asthma, can occur due to this Exubera. So thus it is banned. Then we have Efreza. Efreza is actually a recently approved nasal insulin. Okay.
thank you and thank you for watching.